Dear brothers and sisters, pilgrims to the Holy Land, Assalamu alaikum wa rahmatullahi wa barakatuh. And congratulations for getting this great grant from Allah, going to Hajj. Of course, all of us, before going to Hajj, would have to get the certificate of vaccination. Of course, maybe most of you or all of you have done this already, or should be doing this when applying to Hajj. Why do we get vaccinations before we go to Hajj? This is very important because when we go to there, we have people coming from all over the world. It is populated, heavily populated and crowded there, and people coming from different parts of the world bringing the bacteria and the viruses that causes disease from different places. Some areas people are immune already to that because they're being exposed to it since childhood and get vaccination to that. Other areas do not have that strain, and as you know or might know that the viruses do have different strains. So vaccination is important and very mandatory for the time of Hajj. There are some vaccines which should be given to the people going to pilgrimage, and the authorities of the Saudi Kingdom would not allow anybody to come inside and perform Hajj without having these vaccinations. The major and the most important is the meningitis vaccine. The meningitis vaccine is given to everybody going there, and it must be given at least 10 days before going into Saudi, and if you have the certificate, it's valid for 3 years. You should have this certificate, and you should give it to the airport officials when you're going inside. And of course, the people who are above 2 years and adults will be having a single shot of dose of the vaccination for the meningitis. Younger age, before the age of 2 years, would have a dose of 2 doses with a separation of 3 months in between, and of course they still have to give the certificate while they're getting into the airport. Some of the areas, some of the countries, when they travel to the Saudi and during the time of pilgrimage, the people coming from there would receive an extra drug, a single tablet or a capsule of ciprofloxacin, which will be giving them extra immunity for some of the diseases. Other vaccines, which is very important, is the influenza vaccine. And this is the influenza is different from one country to the other because the strains of influenza are different from one country to the others. They mutate, they change their shapes and methods of attack. And of course, each country has the common vaccine or the vaccine for the common strains for influenza. And there is the pneumonia vaccine, which is made for not necessarily to be taken especially, but for those who would have chest disease, they have heart disease, they have the immunity lowered by some other diseases like cancer. They should have a protection against pneumonia and should have the vaccine for the pneumonia. One of the very important diseases that should be taken care of and one should be vaccinated against is the hepatitis. Hepatitis is endemic in many countries, and the people coming from there should have the vaccine against the hepatitis. Last but not least vaccine is the oral poliomyelitis vaccine, which is given to children or should be given to children below the age of 15, and they should have the certificate for that. Brothers and sisters, we hope that you come back safely, inshallah, from Hajj, and you'll be having the good health in there. Please do not forget to make dua for us here in Huda TV and our families, and inshallah, please come back safe. Until then, assalamu alaikum wa rahmatullahi wa barakatuh.